And I'm Tjeerd van Staa. I'm working at the University of Manchester at the Health Informatics Group, and we're dealing with health data research. My organization and the group I work in, we're very interested in health data and using health data to feed back information to the healthcare system. Because at the moment clinicians do a lot of work, but there's not always good evidence about what's working well and what's not working well, and we want to use the data to analyze it and then feed back the information, evidence back to them. I think one of the key challenges we all face when you work with health data that are collected in the routine healthcare setting is the variable data quality, the different ways of collecting data, etc. So one of the real opportunities I think for the foundation is that we develop better methods to analyze those data. Different stakeholders with different perspectives, they can help in that development of better methods in how to look at data. I think it's a very important opportunity to become much better in quantifying data quality. We all know data quality, we talk about it, but we actually don't know how to measure it. That's the fundamental challenge, and how to incorporate that into our decision making. Because it depends on the question, of course, how important the data quality is. And so there's the real opportunity that we should become much better in quantifying uncertainty around certain data elements and see whether our answers we get will depend on the data quality. If they do not, then of course we're more reassured that we followed the right approach. When they are dependent on data quality, we should take a step back and question whether actually our answers are the right ones. So better quantification of data quality I think is very important. I think it's critical because if you have health data, I can look at it from the epidemiological perspective, from the data analyst perspective. A clinician will look at it differently and will have different questions. A patient will have different questions. A regulator will have different questions, and an industry also have different questions. So working together will better define the questions you ask of data. So I think it's absolutely essential. The real question is, of course, how the Institute can help us to get better health data analysis. I think one of the essential things of good data analysis is replication and its sharing of good practices. We don't do that enough. We don't share programs, we don't share good practices. So if the Institute can help to facilitate sharing of good practices, I think that would be an enormous step forward.